Examination of the cardiovascular system begins with inspection of the vascular system, chest, skin, and nails.
Inspection always has to be on bare skin. I'll start with inspection of the vascular system. I'm going to be looking at the arms and at the legs. On the legs, I'm looking for any skin lesions. I'm looking for equal hair distribution, which I note even hair distribution, and I'll be inspecting the arms as well for even hair distribution, and I don't note any skin lesions. I'll be inspecting the chest for pectus excavatum and carinatum. I'm looking for symmetry. I'm also looking at the apical impulse. Do you mind lifting your breast up for me? I'm looking for the apical impulse in between the fourth and fifth intercostal space, and I don't know any heaves or lifts. I'm going to be inspecting the skin for ecchymosis, any venous distension, any cyanosis, which I don't note. I'll be inspecting the nails for any clubbing, spooning, bow lines, any splinter hemorrhages. I don't note any cyanosis.
Examination of the cardiovascular system continues with palpation for landmarks.
For the bony palpation landmarks, I'll start at the suprasternal notch, the manubrium, to the angle of Louis, and down the body of the sternum. Do you mind lifting your breast up for me? For the xiphoid process. Next, I'll palpate the ribs and the intercostal spaces, first on the right sternal border, then on the left sternal border. And again, if you mind lifting your breast up for me.
Palpation of precordium.
For palpation of the precordium, I'll have you lay down with your head that way, please. I'll start with palpation at the apex of the heart, the left sternal border, the base of the heart, right sternal border, the epigastrium, and the left axilla under your arm. You can sit back up.
Palpation and grading of pulses.
Okay, so for the pulses, I'll go ahead and start with your carotid pulses, which are always palpated one at a time. Carotid pulses are +2 out of 4 bilaterally. For radial pulses, radial pulses are +2 out of 4 bilaterally. Brachial pulses, pulses are +2 out of 4 bilaterally. I'll move down to the feet for both pedal pulses. For dorsalis pedis, it's +2 out of 4 bilaterally. And finally, posterior tibial. Both posterior tibial pulses are +2 out of 4 bilaterally.
Examination of the cardiovascular system will conclude with auscultation, general cardiac auscultation.
For the cardiac auscultation, I'll listen in 5 different places. As I listen, or before I listen, I will let you know where I'm listening to and to which valve. First, I make sure that my stethoscope is online. Second intercostal space, right sternal border for the aortic valve. Second intercostal space, left sternal border for the pulmonic valve. Third intercostal space, left sternal border for Erb's point, also the pulmonic valve. Fourth intercostal space, left sternal border for tricuspid valve. And the last one, I'll have you lift your breast up, please. Fifth intercostal space, left midclavicular line for the mitral valve.
And auscultation for bruits.
So for bruits, I'll be listening with the bell of my stethoscope. First, I'm going to listen to your neck for carotid bruits. For bruits, I'm listening for a whooshing sound, which I do not expect to hear. If I do, that indicates that there's atherosclerosis. Do you mind holding your breath? Good. For the other bruits, I'll have you lay on your back and I'll be listening to your belly. For aortic bruit, it's 2 finger breaths lateral to the umbilicus on the left side. For renal bruits, 2 finger breaths lateral, 2 finger breaths superiorly on each side. And for iliac bruits, 2 finger breaths laterally and 2 finger breaths inferiorly on both sides. Okay, and you can sit back up.